So it is a free program for those with limited resources who need extra help but have that desire to stay home.
Good afternoon, everybody. It is Franchise Friday, and we are going to continue the conversation of ways to pay for care. I'm here today with Deb Marasco, Community Outreach Manager with Immanuel Pathways, also known as PACE Program of Nebraska, right? Mm-hmm. And we're going to discuss PACE program. So the PACE program is a subsidiary of a Medicaid program here in the state of Nebraska and of many states, right, Deb?
Yep, 31 states have PACE programs currently.
So can you explain what PACE is and what it covers?
Absolutely. PACE stands for Program of All-Inclusive Care for the Elderly. Elderly meaning those over 55, which sometimes gives me a little bit of a rash as I get close to that. But it's really for folks who need that extra support but have the desire to remain in their homes. It is a collaborative effort with the state of Nebraska and Centers for Medicare and Medicaid. So it is a free program for those with limited resources who need extra help but have that desire to stay home. It is wraparound services, so coordinated medical care, transportation, help in the home, really those things that make staying home possible, and it's funded by Medicare and Medicaid.
Absolutely. And how does one qualify for the PACE program?
So someone has to be 55, they must live in our prescribed service area, which for Nebraska it's largely Douglas and Sarpy counties with a few outlying zip codes. So they have to be 55, live in our service area, and then they need to meet that nursing facility level of care, which is accomplished after an assessment by our occupational therapist and our nurse. That assessment's done in the home. We send it to the state and then they certify. So we need to show the state that someone needs the level of help provided by our program. So help with those things they're doing every day, bathing, dressing, med management. There's a whole bunch of things that go into that assessment. Risk factors, falls, chronic health conditions, all of that weighs into that level of care. It's seen as a waiver, a home and community-based waiver in the state of Nebraska under their Medicaid program. So very similar to home and community-based Medicaid waiver. PACE can also serve folks in an assisted living to give them that extra support to keep them out of that long-term care setting.
Perfect. And one thing too, for agencies like A Place at Home and other home care agencies, PACE is a great contracted partner. We've been doing work for you guys for I believe 6-7 years now.
I was going to say it's been a while. Mm-hmm.
Yeah, right when you guys came out, I remember when PACE started. And actually that's my next question. PACE was, when it popped up, it just like popped up overnight to me anyways. Maybe everyone was prepared for it, but how do people find out about PACE in their areas?
You know, I think you should be able to access that through your state, through your Medicaid programs.
Okay.
Through each individual state should have that.
Yeah, it's a great option. It's definitely a great option.
It works. We love our partnership with A Place at Home. You know, our folks need a high level of care. They need that extra support in the home, and you guys do a great job for us.
Perfect, thank you. Well, that's it, guys. Thanks, Deb. That's Franchise Friday. Make it a powerful weekend. Just another way to pay for care that you need to look into when you're looking at these things. So, enjoy your weekend.